Okay, so let's say that your blood sugar is running 140. They'll give you a long-acting insulin, like Lantus, for example, that will bring you down to that 100 range for while you're when you're fasting. Then all you have to do is before you eat, you figure out what you're going to have for carbs, and you take that dose of insulin. So if you're going to have 45 carbs, you take enough insulin so that all you do is this, okay? Just little, minute, up, down, up, down. And that's what the goal is. So let's say you walk out to the mailbox, you're a type 1 diabetic, you take your insulin, you make your lunch, you walk out to the mailbox, grab your mail, come in, eat your lunch while you're reading the mail. And you do this every day. Today you take your insulin, you walk out to the mailbox, and one of these big red trucks drives by and stops at your neighbor's house, and you sit down on the rock wall and eat. Sit down on the rock wall and watch. Well, pretty soon you don't feel good, you're fatigued, you're sweaty, and by the time you get back to the house, you know you're supposed to do something, but you can't remember what. You sit in your chair and your blood sugar drops. So EMS shows up, and sugar's 30. So we give them an AMP of D50, right? If you're in a state other than New Hampshire, right, you give them an AMP of D50. Or if you're in the ER, you give them D50. And what happens is, that's 50 grams of carbohydrate. 25 grams, I'm sorry, of carbohydrate, right? And so, it's been so long since I've used it. 25 grams. 5 or 6, 8 minutes later, your blood sugar's up around 180, and we sign them off. Hey, but this was simple sugar. You need to, ma'am, you need to make your husband some macaroni and cheese, make him a sandwich, whatever it is, and have some more complex carbohydrates. So let's say you told him to have a peanut butter and jelly sandwich. 2 slices of bread, we're looking at another 30 carbs. A couple of tablespoons of peanut butter and jelly. I don't know. Let's say it's 30. So now what kind of carb count have we given them? If we gave them the D50, we gave them 25 and 60. That's 85 carbs. If we walk in there and the guy's awake and his sugar is 30 or 40, and we give him the 300 of that slurry, and then we have him eat a sandwich, now we're at 360. Well, guess what's going to happen? After we leave, their sugar is going to keep climbing. And, an hour later when they feel like absolute dog crap again, they're going to check their sugar and go, oh my God, it's 370. They're going to look at their sliding scale and take X amount of insulin, and they're going to do this for about 3 days. Now, here's the problem. The last time your blood sugar hits 200, you've got another 3 days. During this 3-day period, because your sugar's been over 200, you have problems fighting infection and clotting. So now at the last point, let's say at 2.5 days, the last time it hits 200, it's another 3 days of clotting infection issues. So because we pounded 360 carbs into this guy, we've screwed him for 5 days. He's at risk for clotting issues. He's at risk for infection. So slow and steady is what these folks recommend. And what they're recommending now is called the rule of 15s. So you check a sugar and it's low. You give them 15 grams of carbohydrate. Wait 15 minutes. Recheck their sugar. 15 grams of carbohydrates as needed. So, 4 ounces of orange juice by itself. Here, drink this. 4 ounces of Diet Coke, regular Coke. Jeez, I'm crap. 4 ounces of regular Coke. 4 ounces of milk. A slice of bread. Most bread is in that 15 gram range, okay? Wait 15 minutes. So, I've done that on calls, and the problem is it can take you 45 minutes or so to get their sugars back to normal, going nice and slow. Or to make sure, but you give them 15 grams, wait 15 minutes, and their sugar's now at 80. Give them another 15 and wait 15 minutes. Now we're at 30 minutes. but they're at 140. That's acceptable. And then you can tell them, yes, you need to have some dinner, okay? Protein and a little bit of fats and a little bit of carbohydrates, okay? The fats help slow the absorption of the carbohydrate down. So that's why peanut butter and jelly, not just jelly, okay? Because peanut butter has a lot of fat in it too. So this is what they're recommending. And this is why 4 or 6 years ago, the state of New Hampshire got rid of D50 on its protocols. We were pounding 25 grams in and cranking it up, but hey, we could leave quick. So this is why now we use D10, and off we go. Now, 10% dextrose in a 250 ml bag is 25 grams. So you pound that 250 bag in, you're still giving them 25, but it takes quite a bit longer to run that 250 in than it does an amp of D50. So, and the other idea with this protocol is that you start the D10 wide open. As soon as they start to wake up, you shut it down to KVO, check their sugar. If their sugar's still, 60, you give them a little bit more. They become more fully awake, you shut it off, you check their sugar again. Okay? So highly recommend that. We don't want to mess with our patients. We don't want to hurt them. We don't want to make them at more risk for other things. Okay? I think that's pretty much everything I wanted to cover. Got that. So just keep in mind the difference between the type 1 and the type 2s. And please, if nothing else in this hour and 10 minutes, please don't jack their sugars up with that orange juice slurry. Don't do it. All right, anyways, Kevin Drinks, EMS Abounds, and that was diabetes. Thank you.